What if that normal blood pressure number you've been chasing for years through pills, daily monitoring, strict dieting is actually why you feel dizzy every time you stand up? Imagine your screen flashing, "Seniors, stop now." The real truth about BP for older adults is so different that following old advice could put you at risk of falls, fractures, or the ER without you realizing it. I'm going to show you one dangerous myth about the ideal BP for people over 60. Hint, it has nothing to do with 120 over 80. Here's the myth that keeps getting repeated in waiting rooms and on morning TV. Lower is always better. Get your blood pressure down as low as possible and you'll be safe. That sounds logical, right? Except for one problem. And don't miss this. Your body after 60 is not your body at 40. Your arteries have stiffened. Your heart doesn't pump the same way. Your brain needs a certain amount of pressure to push blood past those stiffer vessels. Drop below 100 over 60, numbers some doctors call excellent, and you're not protecting yourself. You're starving your brain of oxygen every time you stand up. That dizziness, that confusion when you rise from a chair, that's not normal aging. That's a warning sign you were told to ignore. Stop now isn't a scare tactic. It's permission to question your numbers and maybe save your balance, your memory, or your life. But wait, if lower isn't always better, why does every public health message push the opposite? Most famous blood pressure studies either excluded people over 60 or averaged their results with younger adults. That's a blind spot. In 2016, an NIH-funded study called SPRINT looked specifically at adults 65 and older. The results shocked researchers. Seniors who kept their systolic pressure between 130 and 140 had significantly fewer falls, plus less confusion and lower rates of fainting than those pushed below 120. The group with higher numbers did better. Why? Because at 130 to 140, their brains got enough pressure to overcome stiffened arteries without overworking their hearts. That's the pattern interrupt most doctors don't have time to mention. But I do, and the ideal number isn't the same for every senior. Here's where one-size-fits-all advice falls apart. Two seniors, same age, same gender, can have safe targets 20 points apart. Do you have diabetes? History of stroke? Take medication for sleep or prostate? Each changes your safe target by 10 or 20 points. Most doctors don't ask about your daily dizziness or if you've grabbed the kitchen counter. They look at a chart and pick a round number. So here's something you can use right now. If you've ever felt dizzy standing up, your ideal systolic target might be 130 to 145, not 120. That alone could change everything. Next, 3 questions that take 30 seconds and could save your balance. Here's what stop now actually looks like. You don't stop your medication. You stop trusting a generic number. Until you see your doctor, don't change a single pill. But do this starting tonight. Every time you stand up, pause 5 seconds. If you feel dizzy, write it down. That diary is more powerful than any chart. Then tomorrow, ask these 3 questions. 1. Based on my age and anything that might increase my fall risk, like dizziness, what's the safest systolic range for me personally? 2. If I feel dizzy between readings, should we consider raising my target by 5 or 10 points? 3. Are any of my other medications, for sleep, pain, or prostate, quietly lowering my blood pressure? If your doctor brushes you off, say this. Can you please note in my chart that I asked about a higher target due to dizziness, and you recommended staying where we are? Watch how the conversation changes. That exhaustion at 2 p.m.? That isn't aging. It's a medication mismatch you can fix with 3 questions and 1 conversation. And that conversation starts tomorrow. You've been told lower is always safer. That dizziness is just aging. Trust the chart. But now you know the study. You know the 3 questions. And you know that stopping doesn't mean quitting your medication. It means stopping blind trust. Your body is not a mistake. That grab for the counter isn't weakness. It's information. And information is power. So here's what I need you to do right now. Pause this video or screenshot this moment and write down those 3 questions. Start that dizzy diary tonight. And before your next appointment, watch this one more time. Of course, talk to your doctor before changing anything. These questions are a conversation starter, not medical advice. But it's a conversation worth having. Safer isn't always lower. Smarter is knowing your number. Now you do.